The purpose, the mission of this program is to provide culturally sensitive medical service to Korean American population in Greater New York and New Jersey area. In particular, we are dealing with many first-generation immigrants with pretty large language and cultural gaps. We started Korean medical program at Holy Name 5 years ago. And Holy Name is a great place to have this kind of program because the hospital is located right in the middle of Korean community in Teaneck. It's nearby Palisade Park, Foley, a lot of high concentration of Korean populations in Bergen County.
The goal of the health fair is to provide a forum for screening for most common diseases seen in the general community as well as among Koreans. And so there's actually a voluntary group of physicians and healthcare practitioners that are involved in the Korean medical program, and we have various events throughout the year that focus on different aspects of health or mental health. And this is one of the main events that we do every year. It attracts hundreds, I think we may be over 1,000 this year, of people in the community who are uninsured or underinsured. They get an opportunity to have pre-screening with blood work, and then a variety of screening happens on the day of the actual program. So it's made up of basically volunteers, and it's just a nice way to get together and be able to give to the community.
Well, it has certainly grown within the last 4 years, this Korean Health Festival, which is an amazing outreach to the community. And first of all, I want to applaud the 60-somewhat doctors that are here giving their time, and over 300 volunteers to also help the community.
In terms of doctors, we have 35 different specialty area doctors came. So, for example, internists, about a dozen internists came, and their job was to meet with individual community members and review the blood test results. And they are the conductor in the orchestra, so they were reviewing the results and sending them to cardiologists and endocrinologists and liver specialists and whatnot. And then we also had a whole bunch of surgeons came, general surgeon, colorectal surgeon, neurosurgeon, and they were available to do consultation service as well. So you can see there are many different specialty doctors came together to provide a very specific screening, detailed screening, but also a lot of consultation, even OBGYN doctors and endocrinologists, urologists. So you can think about almost any specialty area that our doctor, at least one doctor was there.
Well, I remember, I guess 4 years ago when it was first here, unveiled here, so to speak, there were hundreds of people that came to the festival. But today you're seeing thousands of people coming. Certainly an increase in awareness, and which is wonderful because you're not only seeing seniors, you're seeing young families, and you're seeing, working families that are here because they can't afford health insurance. So this is one way to help our community. And of course, it's not only the Korean community. Health insurance is very expensive today. So this is so important, whether there's a language barrier, whether there's a cultural barrier, that they're here to feel comfortable and at ease with the doctors, the student doctors, the volunteers, and that they're getting the information explained to them directly that they can understand.
Now, when we treat patients and cure our patients, we like to take a lot of credit, but in truth, it's because we catch them early before permanent damage is done, whether it be cancer or blood pressure or heart disease. So what they do is they will not get screening or routine blood work which will allow us to detect them early on and treat them and prevent things from getting worse. So particularly in this current economic environment, that's rampant. People show up with humongous tumors or horrible diabetes that went untreated. So by doing this annually, what we're able to do is we select out at least 1,500 patients and screen them. If we see something that needs to be addressed, we will address it. And we'd like to take care of everybody for free, but the finances of medicine is such that we can't. So what we do is we do thorough analysis of their financial needs, and we'll develop a program based on their needs. If they have completely no means, we will do it as charity. If they have some means, we will expect them to provide their share that's appropriate.
Again, prevention, awareness, and treatment is the #1 goal here, not only in the Korean community, but in Bergen County in the state of New Jersey, that we're all here together to provide access to women's health care and access to universal health care.
Without the assistance and the help and support of the donors, none of this will be possible. And especially the hospital. The hospital administration has been behind us, providing the space and ancillary services and everything that goes along with it. Without them, none of this is possible. But if you look at the success of this program, it also tells you the need of the program in the current economic environment especially. So I urge you to continue your support, because as long as we're successful, that means it's much needed.
We are serving about 1,500 community members today, but I know there are many more underserved population in New York, New Jersey area, going well beyond the Korean community. And statistics shows very clearly that there are many uninsured population in this area. And I love to be able to offer this kind of service going beyond the Korean community. Funding is one of the challenging aspects. If we get more funding, we will be ready to expand our service. And we know how to mobilize doctors, and we know how to mobilize volunteers, and Holy Name Medical Center is ready to support infrastructure. So we have all the shells and all the infrastructure in place, but the main area that we are looking for more support from our community is that donor base. So if we can get more help, certainly we'll be prepared to expand the population with this kind of annual health screening service.
Thank you to Kyung Hee Choi, who is the director of the Korean Health Festival here at Holy Name. She is the one that has put this together the last 4 years. She has attracted the doctors, along with Dr. Yang, the medical director of the Korean health community here. And so together, the two of them partnering to bring in the volunteers, to bring in the doctors, and getting the word out, we applaud them for their commitment and their passion.